Good afternoon, everyone. I hope that all of you are doing fine. I'm so sorry, guys. I know you are like waiting for my videos, and my exam is also coming soon, so that's the reason I could not really um uh, find out time to do these recordings. But I know these are really important, so I'll not waste more time and we'll start. So we'll start from here. So, if bleeding occurs after oral surgery, what is the best thing that you need to do is the apply firm pressure. That is the foremost and most important thing to do to stop the bleeding. Okay, and at the surgical wound, and consider using an absorbable hemostatic pack, such as like in clinic we generally use gelatemp, right? So they can help with the bleeding as well. This is sufficient to stop the bleeding in most instances, even in patient taking antiplatelet or anticoagulant therapy. If bleeding persists, so you have done the pressure thing, still patient is bleeding, what you need to do? First you need to do the initial management. Sorry, first you need to assess the area, like you need to see from where is bleeding coming from to determine the site of bleeding. So for example, they have shown here, so they said that mucosa near the floor of the mouth, it is very common to be bleeding, like mucosa is with common site. Then the second common site is the subgingival region, this is the site, but it is very uncommon to see bleeding from the socket wall or the apical region. Okay, so the tissue which are neighboring to the socket would be the most common reason of the bleeding. Okay, then you need to perform the local hemostatic procedure. We will see in table 23 what they meant by this thing. Then common signs of persisting bleeding after tooth extraction include the mucosa, which is near the floor of the mouth or the tongue, or the gingiva at the alveolar crest. So these are two of the common sites to be bleeding. Uncommon sites are the socket wall and the apical region. Then what management you can do? First of all, you need to do the initial screen and management. What this can be, because your patient might have gone home, right? And the patient called you that I'm like my socket is still bleeding. It's been 1 hour or after half an hour, the fresh blood is coming out. Then what you need to do, you need to check the patient's medical and medication history. So same thing, like if the patient has any bleeding disorder, or if the patient is taking antiplatelets, anticoagulant, or any medical condition that can affect the bleeding thing, then first you need to reassure your patient. In most cases, the following approach stop the bleeding. What you need to do, advise your patient to sit upright. And because whenever you give the post-operative instructions to your patient, you always give some extra gauze piece to him, because if in case that the socket is still bleeding after half an hour, he can change it, right? So ask him to be sit upright, place a small gauze square or small clean cloth directly and firmly over the surgical wound. If he does not have any gauze pack, he can use the small clean cloth. Then what he need to do is apply the pressure. Bite hard or press a finger firmly over the wound for 15 minutes. So he needs to put the pressure for 15 minutes. Then check if the bleeding has stopped. Common mistakes common mistakes that result in inadequate pressure at the site of the bleeding include, so what commonly could have went wrong is he might have placing gauze over the adjacent teeth, so not at the correct area where you need to place the gauze. Okay, or you are using excessive amount of gauze, so the pressure would not be there, right? So if we are using more amount of gauze than it is required, then the patient cannot put the enough pressure that it is needed to stop the bleeding. Advise the patient, what you need to advise him, not to keep rinsing or spitting, because that would delay healing. And do not use paper towel, paper tissues, or cotton wool. He can only use clean cloth or the gauze. Remove the gauze or clothes too soon. Do not, he needs to wait at least for 15 minutes by putting the enough pressure. Do not remove it so quickly from the bleeding site. Contact the practitioner who performed the surgery. Then, even if he has done all these things at home, still he is bleeding. What you can do now, if bleeding does not resolve with this initial management, then you need to call the patient and he'll be in your chair. Then use suction and a good light to examine. First you need to identify the bleeding site. Okay, then check for active bleeding. You need to check if there is active bleeding which is still coming, or the brisk bleeding is usually from torn soft tissue rather than the socket. Then what you are previously you are asking your patient to put the pressure. Now you have find out the bleeding site, and now you are putting the pressure to stop the bleeding, but still the patient is bleeding. What would be your next step is you can use local hemostatic procedures after applying appropriate pressure at the surgical wound. So what could be the additional measure? First of all, you can try to infiltrate with a local anesthetic which contain adrenaline, because you all know that vasoconstrictor can constrict the vessels and would help with the stopping of bleeding. You can also use an absorbable hemostatic agent to pack the surgical wound, such as gelatamp. You can use that, or ribbon gauze is an alternative if a hemostatic agent is not available. Then, in patient taking warfarin, there is an additional step which is the tranexamic acid. It can also be applied topically as an additional hemostatic method if pressure is insufficient to stop the bleeding. Tranexamic acid stabilizes an existing blood clot, but keep in mind that tranexamic acid helps in stabilizing the existing blood clot. It does not really help in formation of blood clot. Either rinse the bleeding site with tranexamic acid solution or use a gauze pad soaked in tranexamic solution to dress the bleeding site. Emergency department transfer. Even if you have done all the things that you could do for that patient, but still he's bleeding, then you just need to call the hospital. um, okay, and you need to call the hospital and you need to arrange urgent transfer to an emergency department. Okay, so this is what the management of the bleeding. It is very important. There would be scenarios in the exam, either for the pain, patient has dry socket, or the bleeding after the oral surgery. For sure, there will be at least two scenarios, if not three. Okay, so next topic is dental and maxillofacial trauma. It is also very commonly seen, mainly in the kids. So we need to be aware of what emergency treatment we need to perform, and what later we need to look out for. And along with this, there are some trauma guidelines. I'm sure you must be aware about the trauma guideline for the kids, for the adult teeth, and for the baby teeth. So I would suggest reading that trauma guideline along with this chapter. And there would be one scenario from lateral luxation or avulsion. They both are very important. Okay, and there could be other scenarios as well, like for concussion, subluxation. In short, you just need to know how to diagnose what condition has already happened. Okay, so it is very important that you read those guidelines, and you should know how to manage the patient, at least in the emergency appointment. Okay, then a broken tooth or filling or a lost filling. Teeth, fillings, and other forms of restoration, such as crown, veneers, it may break for various reasons. Damage to the tooth or restoration can occur during normal functioning. It can sometimes be patient comes with the complaint like, I was just eating my sandwich and my filling came off. right? So it can happen or following the trauma. Restoration can also be lost due to further decay in the tooth. So if there is any secondary decay happening inside or beneath the restoration, that could lead to loss. Patient could lose that restoration. Okay, because that undermines the restoration, leaving it unsupported. Pain associated with tooth damage indicates that the dentine or pulp has been exposed. So if there is any pain which is coming, patient is coming with the pain, he has lost his filling and now he is in pain, it means either the dentine or the pulp part of the tooth is involved with that. So what would the exposure of dentine would look like? It would cause intermittent pain, which we also known as reversible pulpitis, that occurs only when the tooth is exposed to a stimulus. So which could be the stimulus? If patient is having hot, cold or sweet food or drinks, the pain is coming and it's going away as soon as the stimulus is removed. If the patient presents to a medical practitioner, it means the patient does not come to you, he went to the GP, then the GP would advise him to visit a dentist as soon as possible. And what treatment he can offer him is the analgesics. Analgesics and antibiotics are not indicated in the interim because it's not that severe pain, it's just intermittent pain. It just comes and goes. So best thing is the patient should visit a dentist. We can do some fillings or like IPC or DPC, whatever the condition is. Exposure of the pulp. Now the pulp is exposed, so it means irreversible pulpitis. It will cause more severe pain that would persist as a dull throbbing ache even after the stimulus is removed. Red soft tissue seen in the area of fracture or within a cavity indicates that the pulp has been exposed. When you will see it clinically, you can see a red soft tissue in that area. So that means that the pulp is exposed now. Typically, this tissue is very sensitive to touch, and the patient may be avoiding any contact of this tooth with the tongue, food, drink, or cold air. Because if the pulp is exposed, it is very severe pain, and patient just avoid to just touch that area. The exposed pulp may bleed or have a blood clot over it. Tooth damage with pulp exposure requires urgent dental treatment, which would be preferably within 24 hours to prevent further damage or infection of the tooth. Okay, so if a delay in dental treatment is expected, then if for certain circumstances, either due to patient medical history or whatever the scene is, you cannot do the dental treatment in today's appointment, then what you need to do, you can at least help the patient with their pain. You need to prescribe them some oral analgesics. Either it could be Panadol, ibuprofen is the best one. But sometime if patient has some medical history, for example, like asthma or any other condition where we cannot give him the ibuprofen, then we need to modify our analgesic treatment. Or you can also do some local anesthetic, try to numb that area. Just meanwhile, we can get things sorted out for him or what. Okay, so for example, if the patient is taking like corticosteroid treatment, prednisolone, so we need to book an appointment in the morning. And the other thing is we also need to prescribe the antibiotics because of the prednisolone. If he is taking it from the longer duration, then his immunity might be lower, right? So we need to take advice from GP. So what if you cannot do the dental treatment, at least give him some painkillers or like inject some local anesthetic. Placement of covering materials such as calcium-based dental cements, temporary filling materials over the tooth fracture or exposed pulp requires dental expertise and should not be, if the patient goes to the GP, he should not like try to put some covering material or anything. It is dental expertise. Antibiotic therapy is only indicated for a broken tooth if there is an associated spreading infection. Spreading infection means if the patient has facial swelling and fever. Only in that cases we need to prescribe the antibiotic. Then is the case of tooth avulsion. Like mostly it would come with the kid. Like kid was playing in the playground and he knocked his tooth out. So what you need to do the initial assessment, how you can manage that thing. Okay. First, the initial assessment you need to check for other injuries. That is head and neck injuries. Do not reimplant baby teeth. This we all know that we do not need to reimplant the baby teeth. Do not scrape or handle the root of the tooth. Do not hold the tooth by this area, just hold the crown part. Rinse the tooth with the dairy. All know that the milk is the best medium in which the tooth can even stay alive for the tooth root tissues can stay alive for 6 hours, or saline if it is dirty, but do not use water because of the osmolarity of the water. It could destroy the PDL cells. Okay, then reimplant adult teeth as soon as possible, because you all know that if we reimplant the teeth within 15 minutes of time, the prognosis would be much better. Use a temporary splint to hold the reimplanted teeth in place until the patient can see a dentist. So this is for the medical practitioner, but these things also give you an idea what you can expect. Ensure that tetanus immunization is up to date. Prescribe antibiotic therapy, because for avulsion you need to prescribe an antibiotic therapy, that is this one, doxycycline, tetracycline, and refer to a dentist urgently. If the tooth cannot be reimplanted immediately, then do not let the tooth dry out. Store the tooth in dairy milk. If milk is not available, I'm sorry. Then your other options are you can store the tooth in saline, saliva, or plastic wrap, but do not use water. No water at all. Okay, how to assess the tooth assessment of tooth avulsion? So avulsion of a tooth is the complete disarticulation of the tooth, like tooth has completely came out of socket. In most cases, the tooth is knocked out of the mouth completely, but occasionally it may remain in the mouth. Okay, and assess all patients for their head and neck injury. If they had any headaches or if they had any other issues, first you need to find out that thing, and later on the dental thing. Then assess if the tooth has been avulsed. You also need to find out if the tooth has gone completely came out, or it has got intruded, it means pushed into the bone, or the tooth root may have fractured so that only the crown has been lost. You need to assess it, like how much part of the tooth has avulsed. Refer the patient urgently to a dentist for x-ray assessment and management of an intruded or fractured tooth. If a tooth appears to be missing and is not found at the site of the accident, consider if the patient, because you need to ask the parent or the patient, like, did you found the tooth, where is the tooth? So if they cannot find it, there could be some chances that the patient might have inhaled or swallowed the tooth, so we may need to do some investigations for that as well. If the avulsed tooth has been retrieved, if they found out, then you need to determine whether it was a baby tooth or it was an adult. Children older than 5 years may have a mixed dentition, so it could be quite difficult to distinguish between them. In general, primary teeth are much smaller in all dimensions. So this is just for the, like, general practice. Sorry, I'm sorry. GP to how can they? We all know that the how does the baby tooth look like and how would be the adult. So this is just to give them an idea. Additionally, the root of a primary tooth resolve when they are nearing the time they would naturally fall out, so appear blunted and shorter. So here they have given the um, pictures, and you also need to check the patient tetanus immunization. And along with this, you can also read the chart which is given at the end of this book about the tooth exfoliation and the tooth eruption. You need to know at which age which tooth are falling off and which tooth are coming back, coming in the mouth. Okay, then the next step is the replanting and splinting. Do not reimplant the baby teeth, okay? Or do not, because this will damage the secondary tooth. Then hold an avulsed adult tooth carefully only by the crown. Do not touch the root. Okay, then survival of the cells of the PDL, which is attached to the root, is essential for healing, um, uh, for healing of the ligament following the reimplantation. If the ligament heals, the tooth has a reduced risk of replacement root resorption, because after the avulsion there is a risk of resorptions happening. If you will damage the root part, there the chances of replacement root resorption, which is also could be ankylosis, could be increased, because you are damaging the PDL cells which are present on the root part of the tooth. If the tooth is dirty, you can rinse it briefly with the milk or the saline. Do not scrub or rub the tooth. Reimplant an avulsed secondary tooth into the socket as soon as possible, and the teeth which are reimplanted within 50 minutes are more likely to heal without any complications. If the tooth cannot be reimplanted immediately, you need to arrange urgent transfer to a dentist or emergency department. Meanwhile, what you need to do, either submerge the tooth in the cool or room temperature dairy milk until it can be reimplanted. So milk is the best medium, because in that, the cells can survive up to 6 hours. Okay, and all first aid kits should have long life milk. If the milk is not available, then you can also try to wrap with the plastic paper containing saliva or the saline. But in that, the survival would be only up to 1 hour. Avoid using water for cleaning or stirring the avulsed teeth, because the osmotic effect of water causes cell death in the period. So do not use water for these teeth. Then you have now reimplanted. Then what you need to do is put a temporary splint to hold the tooth in position. Use a small piece of aluminum foil or malleable material, which is the blue tack. Then ask the patient to bite down to hold it in position. Refer the patient to dentist urgently for further treatment and splinting. If a delay in dental treatment is expected, then so this is just for the medical practitioner. But what you need to do is just put the tooth back and put some temporary splints on them. There are some Odell cases as well on the avulsion and lateral luxation, and one is on subluxation, the case. So I would recommend reading those and the trauma article for sure. You will be so thorough with all these topic, and in the exam there would be at least 3 or 2 scenarios from that article. So I can't emphasize more, but yeah, try spending some time on that. Okay, so how would you manage the avulsed tooth for reimplanting and splinting? First, you need to check the patient for their tetanus immunization. Then you need to give them the antibiotic therapy. However, there is limited evidence that it reduces the healing complication, which is the resorption. But still, we give them, which is the antibiotic that we give them is the doxycycline, because it has a wide spectrum of action, and some evidence also shows that it has direct anti-resorptive activity as well. So what is the doses? They need to take it once daily for 7 days, and it vary according to their age. So adult can take 100 milligram, and child 8 years to older they 50, then 75 and 100. If in certain cases, like if the kid is younger than 8 years, because we do not give them tetracycline before the age of 8 years, because that is the time where teeth are forming and tetracycline can affect their tooth formation. So if we cannot give them doxycycline, then the other option we have is the amoxicillin, and amoxicillin, sorry, and the doses is 500 milligram orally, 8 hourly for 7 days. Okay, and also because they would be in pain, so they won't be able to, or they would try to avoid brushing. So prescribe them some chlorhexidine mouthwash. Either dose you can prescribe to help to clean the area clean, and also give them some advices like have some soft diet, do not play contact sport until we give you the clearance. Okay, and there might be some pain or swelling, so for the swelling they can use some cold packs. For the pain they can take the normal painkillers, and all these things, and try to find out the reason of the trauma, like mouth guard or whatever the reason is. Then maxillofacial trauma. If there is a severe trauma on their face, then you need to arrange urgent transfer to an emergency department for a patient with any of the following. For example, if they have any loss of consciousness, airway compromise, uncontrolled bleeding, or significant eye injury, then you just need to arrange their transfer to the ED. Although some patients with minor injuries on the to the mandible or zygomatic complex and the nose may look reasonably well at present, but still, whenever the patient comes to you, what is the foremost thing? You need to ask them to visit their GP or the hospital to get full assessment done. Then only the dental treatment would be provided. And for all patients, it is very important that you make sure that the tetanus immunization is up to date. Account for all dental fragment, like none of the teeth fragment or the tooth part has gone inside their body. So you need to find out all those things. Debride any soft tissue injuries. Soft tissue injuries that require operative care by an appropriate specialist. Specialists would include significant laceration of the gums, if there is any significant laceration of the lip or vermilion border, or any degloving injury, then you need to take help from the specialist. To ensure there are no dental fragment or foreign bodies in the soft tissue, you can also take a plain X-ray of the facial skeleton, for example, OPG or the PA skull or the occipitomental view are usually sufficient for the assessment of uncomplicated trauma, but for the like face, the mid facial or the multiple facial injuries, then the patient may need to um, get the CT scan done. Presumptive antibiotic therapy may be required for wounds at high risk. So this you won't be giving them the antibiotic. This is the specialist and the doctor's domain. So we won't be bothered about that. Okay, so if the patient has open injury, then only we will prescribe the antibiotic. But this is not under our domain. We won't deal with these patients. We would just refer them to the emergency department. Okay, so refer all the patients to a specialist as soon as possible for further review and management. So this part is done, and now we need to cover the medical emergencies. This is also very important topic, and in the last exam, there were quite a few questions from this topic. So you need to be more thorough with this. Okay, thank you so much, guys, and we'll see you in next week.